Ms. Thompson, a 36-year-old woman, presented to her primary care physician with complaints of a painful lump near her belly button for the past few weeks. The lump seemed to increase in size throughout the day and was more noticeable when standing. She had a history of 2 cesarean deliveries, but no other abdominal surgeries. Physical exam revealed an incarcerated umbilical hernia, approximately 3 centimeters in diameter. It was tender and firm to touch. The remainder of the abdominal exam was benign. CT of the abdomen and pelvis showed an umbilical hernia containing omentum and a small portion of transverse colon with no evidence of obstruction or strangulation. The patient was referred to general surgery for consultation. She underwent an elective open umbilical hernia repair with mesh reinforcement. The procedure went well without any complications. She was discharged home the same day and recovered well without issues. At her 2-week follow-up, the incision was healing nicely without signs of infection. She no longer had abdominal pain or the lump. She was counseled to avoid heavy lifting or straining for 6 weeks to allow adequate healing time. Annual exams were recommended to monitor for recurrence. Commentary questions. What is the significance of her history of 2 cesarean deliveries? The cesarean scars may have weakened the abdominal wall fascia, contributing to risk of hernia development. What symptoms would raise suspicion for an incarcerated versus strangulated umbilical hernia? Severe pain, inability to reduce contents, peritonitis, fever, tachycardia, dusky discoloration indicate possible strangulation requiring urgent surgery. What are the pros and cons of open versus laparoscopic hernia repair? Open has lower recurrence rate but longer recovery time. Laparoscopic has faster recovery but higher recurrence risk. Choice depends on surgeon expertise. When is mesh reinforcement recommended over primary suture repair alone? Mesh decreases risk of recurrence and is preferred for most elective repairs. Primary repair may be used for emergent cases where mesh increases infection risk. What postoperative instructions are important for patients after umbilical hernia repair? Avoid heavy lifting/strenuous activity x 6 weeks. Watch for signs of infection. Take pain meds as needed. Follow up with surgeon and report any concerning symptoms promptly.